Your dental health is indicative of your overall health. Do you know that your dentist could actually be the first person to spot any healthcare condition which is not diagnosed? This could actually range from osteoporosis to diabetes to even oral cancer. And that's the reason why we must not underestimate the importance of visiting a dentist regularly.
Your mouth, your teeth, your gums and your tongue not only just show you signs of good or bad oral health. In fact, your mouth is an encyclopedia which gives you a mirror image of how your overall health is doing. From malnutrition to systemic diseases, your mouth speaks it all. Well, quite literally.
It is not uncommon to see dentists examine your whole mouth: tongue, face, lips, roof and floor of the mouth. The reason is that these areas disclose a whole lot of secrets and may show signs of various diseases. Our mouth, like other parts of the body, serves as a gateway for bacteria to enter the digestive and respiratory tracts. Our mouth can display signs of malnourishment and various general infections, with lesions, ulcers being the first sign.
A lot of viral infections will also start in the mouth. You can just see a pus boil or a little bit of an ulcer in the mouth. So a good trained eye will be able to detect a lot of other diseases. Cardiovascular health is very closely related to oral health. So a good dentist will be able to detect a lot of conditions, like I said, eating disorders. We can detect a lot of viral infections, like I said. A lot of mental health conditions also can be detected in the oral cavity.
Bulimia nervosa is basically an eating disorder pattern in which the patient tends to have a lot of purging. So tends to that the patient have a lot of psychological disturbances and leading to any depression. They tend to develop this bulimia thing, and because of which a lot of dental problems are associated because of the continuous purging. So by continuous vomiting, the acid reflex comes to the oral cavity, because of which their enamel tends to erode, and this acid tends to eroding of enamel leads to dental caries and other problems with the oral hygiene.
Here's how the mouth is a window to your overall health. The plaque in the mouth can also be caused by an underlying health condition such as diabetes, arthritis, heart disease, or chronic obstructive pulmonary disease. During the visit, a dentist will look at any swelling, lumps, masses, or any abnormalities in the face, lips, jaws, and neck. Oral cancer is a type of cancer that affects the mouth and the back of the throat. It is most commonly found in older adults. Diabetes makes it difficult to keep the teeth and gums healthy, and a dentist may be the first to identify it. Gum disease makes it difficult to control blood sugar levels. X-rays every year can track bone loss in the jaw and around the teeth. A dentist can actually detect the first signs of osteoporosis, which is a condition of progressive bone loss that puts patients at risk for fractures. Here's how.
Osteoporotic patients definitely have poor oral hygiene. They have loosened tooth. They tend to have lose their teeth at the early stage, and because of their bone quality is not up to the levels, because of which they tend to have developed more dental problems comparative to the normal individual.
Enlarged tongue, tonsils, red throat, dry mouth, and worn down teeth from nighttime grinding or clenching are all indicators of sleep apnea, and a dentist is the best person to recognize it immediately. When people have obstructive sleep apnea, their breathing stops and begins as they sleep. Sleep apnea is linked to a number of health issues, including strokes, heart disease, and type 2 diabetes. For an early indication of a neglected health ailment, make sure to not miss any periodical visits to your dentist. With Lavanya Rotella in New Delhi, Sneha Mordani for India Today TV.